the Tom Leykis Show.
Oh, my God.
And now, here he is, Tom Leykis.
Thank you for tuning into the Tom Leykis Show. This is where America gets together to talk about the issues you really care about. It's a different kind of a radio talk program. We're the radio talk show that is not hosted by a right-wing wacko or a convicted felon. No! I am your host. Write down our toll-free telephone number. You're going to need it. It's 1-800-5800-TOM. 1-800-5800-866. Thank you for tuning in. Thanks for being part of our program. We appreciate it. Here we are together again on the radio. This from the Arizona Republic newspaper. Tugging a woman's nipple during a breast exam is like milking a cow. The doctor testified Monday in the continuing sex abuse trial of Phoenix gynecologist Brian Finkel. Brian Finkel, by the way, a past guest of the Tom Leykis Show. It's never done, testified Dr. Sidney Wexler of South Dakota during the 8th week of Finkel's trial. Finkel is charged with more than 60 counts of sexually assaulting and abusing 35 abortion patients as far back as 1986 at his Phoenix clinic. Among the charges are that he squeezed, fondled, and twisted patients' nipples. There are women who would pay you for that. He denies he abused women and says in court documents that he was performing acceptable gynecological procedures. Wexler, one of the prosecution's expert witnesses, taught abortion procedures to University of Southern California medical residents in addition to working in private practices. He said nipple deformities are examined by feeling surrounding tissue. Tugging the nipple annoys patients, he said. Finkel is also accused Finkel is also accused of performing unnecessary rectal examinations on 2 patients. Let me just feel around here a minute. Let me just put my finger in here. Wait a second. Ooh, look at that. Wexler acknowledged under cross-examination that he taught students that, quote, no pelvic examination is complete without a rectal examination. That's what I always say. In fact, I would go so far as to say I have never given a pelvic examination without finishing up with a good rectal exam. And boys, I would recommend that to you as well. However, he said it is a teaching standard that is rarely applied in practice. Rectal exams are typically only done on women age 40 and older to check for diseases, he said. Oh, no. No, it's not just for old chicks anymore. No. He also testified that touching certain parts of the vaginal area during examination is unnecessary because most abnormalities are obvious. What if you're nearsighted? You might have to get down there and get a closer look. Some women have testified that Finkel manipulated their vaginas during exams. Who wrote this story again? Carol Sowers of the Arizona Republic. Carol, such a vivid imagination and such colorful prose. Amazing. Richard Gearloff, Finkel's defense attorney, said his client touched certain areas to detect conditions that are not obvious in purely visual exams. Wexler disagreed. I'll expect to go another 3 weeks. Dr. Brian Finkel. He was a guest on this show. Got a Christmas card from him one year. I got to go back and see if there are any rectal references on it. Amazing. Anyway, there's your story. The twisting of nipples, the unnecessary rectal exams, the manipulating of vaginas. Now they're in court discussing whether these were necessary procedures or not. Now, you know, we've heard all kinds of stories. There have been stories about dentists, what they do when you're under. You know, when you've had the laughing gas or whatever. And we have had stories of gynecological exams. I had an ex who told me one time when she was 14 and developing, her mother took her to the gyno. The gyno was checking out the development of her breasts to make sure they were developing properly. And he got a good close look. So apparently this stuff is much more common than we think. Now, if you're paranoid, I don't want to hear about that, but if your doctor went way out of bounds and did something totally inappropriate, I'd like to know about it. I've always said on this program, I'm suspicious of any man who wants to become a gynecologist to begin with. I mean, why would you pick that field of specialty? What would make you say, you know what, that's something I know a lot about? The groinal area. I'm like an expert in that field. I want to know more. I'm going to go to a university, get a degree in gynecology. Then I'm going to buy the equipment to spread a chick's legs and stick my hand up there like a plumber. That's what I'm going to do. What makes a man want to do that? I think it's creepy. I mean, I do not understand women who insist on having a male gynecologist. Only because I think a guy who wants to do that, and come on. Think how creepy this can be, all right? Imagine there you are, you have your, 32-year-old female patient who comes in one day with her 13-year-old daughter for her first trip to the gyno. The gyno, feeling around in there and checking things out. I mean, come on. What is it about a guy that wants to do that? So that already has some kinkoid features to it. But I'm wondering, have you ever been to the doctor and had the doctor do something really inappropriate to you?
Tom Leykis. 1-800-5800-TOM.
If you're a dog, you're going to stick with it. You're going to hit it. You're going to smack it up, flip it down, rub it down. As long as the kids are out the way, as long as you can knock the stuff it off the egg McMuffin.
The Tom Leykis Show. 100.7.
Leykis Show at 1-800-5800-TOM. All right, has your doctor done something really inappropriate? Christina on the Tom Leykis Show. Hello.
Hello? Hello?
Hello?
Oh, hello?
Yes.
Is this my honey Tom?
Why, yes.
No, it's not. It's Dino, huh?
Oh, you want to talk to Tom?
No, I want to talk to the Italian guy with the nice tongue and the extra surprise.
Oh, Dino you want to talk to?
No, is this Tom? Seriously? Because I have a story.
Who do you want to talk to?
I want to talk to Tom.
Show at 1-800-5800-TOM. This is Christina. Hello.
You're too much. Tom.
Yes.
Tom, let me tell you what happened to me. I was 19 years old, young, pretty. Oh, well, I'm still pretty, right?
Yeah.
Went to the doctor. You know, what had to go to have the routine pap. Well, this old man with this big fat gut, okay? He slides his finger. And, of course, it's very uncomfortable because I'm young.
Now, let me understand. If he was an attractive, hot, young doctor, would this be a problem?
No, because it's a doctor doing it.
Okay, so you would still have a problem with that?
I would still have a problem with it, yeah.
Okay, go ahead.
I was still a little shy about sex,
Right. Mm-hmm.
And anyway, so while the nurse is in there, the nurse is standing behind him, kind of setting things up. And when she's not looking, he puts his thumb on my clitoris.
Really?
Really? It wasn't arousing. I knew something was wrong. I didn't know what was going on. I didn't know if I should say something. What should I do, you know?
So what did you do?
I lay there, and I kind of froze. I wish that I would have said something then, because what he was doing was wrong. And I'm sure that he's doing it to other women if he's still practicing.
Why didn't you report him?
I think I felt ashamed.
Mm-hmm.
I never even told my mother.
Really?
I tell friends now as an adult, you know, I kind of kid around and I say, gosh, you know, if I was, you know, felt comfortable.
Well, let me guess, this was your mother's gynecologist too, right?
No.
Oh, it wasn't? How'd you find this guy?
Just a doctor I used to go to. And I think I saw him maybe 2 or 3 times. You know, I saw him, I think I had to go for the first year maybe twice, and then the third time I saw him.
Mm-hmm.
He did a little thing on me, and I never went back. And I never said anything to anybody, but I wish I had, you know?
Wow.
And I think that, you know, just like priests, you know, they get away because you respect their position and what they do, and it's a horrible thing. Horrible thing. I mean, it's almost like I was being molested.
Wow.
And I'm the one that felt like I was doing something wrong.
That's pretty hardcore. Wow. 1-800-5800-TOM. Deanna on the Tom Leykis Show.
Hi, Tom.
Hi, Deanna.
Hi. This is first time calling.
Cool.
And I was listening to you, and I heard the doctor's name from Phoenix, Arizona, and I went to him when I was 17 years old.
Oh, really?
Yes. And
Did he twist your nipples?
Excuse me?
Did he twist your nipples?
No, but he did compliment me on my breasts.
He did.
Yes, and he told me
Which you liked at the time.
Excuse me?
Did you like that?
No, not at all. I didn't. I thought that was a little weird.
Oh, boy. Mm-hmm.
And then he told me, you know, he inserted his fingers inside of me and told me how tight I was. And then I was just, you know, a little surprised by that. And then, yes, he did stick his fingers at my anal.
Really?
And I was very, very unfamiliar with that area, so I was very surprised, and I didn't know how to react. And being kind of young, I wasn't too sure. And then he also did a little thing that made me very, very uncomfortable. You know, sometimes you get like little pimples on your breast, and I had one, and he popped it.
Really?
Yes.
Did he say why?
No, he just did, and it was very, very uncomfortable. And I wasn't, you know, going to a lot of these doctors. So when I went to some more doctors later on in life, I realized that doctors weren't really supposed to be doing that.
Oh boy.
So it was quite interesting that I heard that.
So you had not heard that Brian Finkel was on trial?
No, this is the first time. I haven't thought about him in years.
Mm-hmm. Well, there you go. It's happening right now in Phoenix.
Yeah, that's crazy. Well,
Wow.
he deserves it.
Oh, boy. All right, Deanna.
All right, thank you.
Thanks for the call. It's 1-800-5800-TOM. It's Amy on the Tom Leykis Show. Hello.
Hey, Tom.
Amy.
We love you here in McCleary.
Thank you.
You're welcome. My story is that I had a doctor while I was 6 months pregnant sing Hopping Down the Bunny Trail while he was giving me an exam.
No.
Oh, yeah. Me and my husband both had to crack up laughing at that one.
Well, it may be inappropriate, but I don't know about actionable.
Well, I'm not as uptight as a lot of these other broads that call in.
So you mean if he stuck his thumb up there, you'd be okay with that?
Well, as long as my husband's there to watch.
Oh, I see.
So, yeah, that's pretty much my story. And I have had a rectal exam as well, but I wasn't uncomfortable with that.
All right.
If they need to feel it, they need to feel it, you know?
Well, the question is, does a gynecologist need to give you a rectal exam?
Well, you know, I think, well, he said that you can feel the inside of your vagina from your anal.
Really?
So, I mean, if that's what he thinks, then I guess that's what he thinks. I wasn't uncomfortable. I don't know.
Well, the doctor who testified in this trial said that no pelvic examination is complete without a rectal examination.
Well?
And I, as a layman, have to agree.
I have to agree with you on the men who want to be gynecologists, though. I almost always go to women gynecologists.
There's something creepy about that.
Yes, there really is. Because the only man that I've ever, you know, that has wanted to be up there, well, usually men who just want to be up there, not men who want to be examining me. for, anything that may be gross. It's
Yes.
really fun.
Yes. By the way, we'll be giving out gynecological exams out here in the parking lot.
Oh, you will, huh?
Yes.
I'm on my way.
Yes, we're going to be giving you a good thorough checkup.
Yeah?
Yes.
Well, I'm nice and tight, so that's okay.
Well, that's good. I'm the king of the pap smear. That's what they call me.
Are ya?
Yes.
King of something, huh, Tom?
Yeah, I got my Q-tip right here. I'm ready to give you a little swab.
All right. And I have to tell you, people dislike me as much as they dislike you for being honest.
Really?
Yeah?
Well, go on down here. I'll inspect your groin, and it'll be a perfect match.
All right. You got a big mouth just as well as I do, so.
Listen to you. All right, Amy.
Well, I do have to say one thing. I want to say hi to my redneck dad who listens to you every single day.
Very good.
We love you, Tom.
Thank you, Amy.
Blow me up.
Here you go. 1-800-5800-TOM. It's Joy on the Tom Leykis Show. Hello.
Hey, Tom. How's it going?
All right, Joy.
Good. I just had a story. I was just 16, and I went to the doctor because I was having really bad back pain. And he told me, to get into a robe. So I sat on his chair, and then I had a big chest, but I had no idea that that's where the back pain was coming from. So he drops my gown to the floor, and he goes, well, honey, let me show you why you've got back pain. And he comes up behind me and takes each breast in his hands and starts to shake them. And he goes, honey, they must weigh 5 pounds apiece. That's why you've got back pain.
Oh, boy. Oh, boy.
I almost died. And then he didn't let me, get my rope back on. He just stood there and he looked at him. And I was mortified. I had no idea what to do.
It was an examination he was giving you, for God's sake.
Oh, yeah, he shook me to pieces, Tom.
Oh, boy. Sounds like you're laughing about it to this day.
Oh, my God. Hilarious.
Amazing.
I love your show. Listen to it every day.
Thank you, Joy.
Okay, bye-bye.
Appreciate the call, 1-800-5800-TOM. Let's take Patty. Patty, you're on the Tom Leykis Show. We're talking to people for whom the doctor did something inappropriate. Hello.
Hello, Tom.
Hello, Patty.
How are you?
Okay.
Wonderful.
Now, by the way, it does not have to be, it does not have to be a gynecologist. It could be your dentist or anybody else. Yeah, go ahead.
He was just an internal medicine doctor, actually.
Uh-huh.
That supposedly gave me a pap smear, but when I went to get my results a couple weeks later,
yeah,
the female doctor said that he never even took a pap smear or never did anything of the sort. So she was kind of looking at me like, are you sure? And I was like, well, yeah. He was down there. He was doing his thing, but it kind of didn't feel right to begin with. But I kind of just let him do it because the nurse was in the room, too. Mm-hmm. So, he ended up not giving me a pap smear. And I don't know what he was doing because there's no record of it at all.
So what was he doing?
He was, what you're supposed to do in a pap smear. You stick your finger in, you kind of do the little deal, the little swab thing, which I thought he was doing, but I guess he wasn't. So
maybe that wasn't a Q-tip.
It probably wasn't.
Maybe he was hung like a Q-tip. I don't know.
Maybe, but I was really surprised because the nurse was in there and everything, didn't really say anything, and he was just doing his thing. So who knows?
Maybe you were doing this thing.
Maybe. Possibly.
Thank you, Patty.
Thank you, Tom.
All right, 1-800-5800-TOM. Has any doctor ever done something inappropriate to you?
It's the Tom Leykis Show.
6:30
on 100.7. This is the Tom Leykis Show.
From Los Angeles to 1-800-5800-TOM. All right, has your gynecologist ever done something inappropriate? How about any other doctor? Your dentist, your MD? Your proctologist, have they ever done something inappropriate to you? 1-800-5800-TOM. Ashley on the Tom Leykis Show. Hello.
Hi, Tom. I just wanted to tell you about when I was 17. My gynecologist was probably in his 80s, and he was really hideous looking. And he's like, come on, honey, get on the table. And I got on the table, and he said, okay, now scoot your tail down. Scoot your tail down just a little further. And I was so grossed out, but of course I did it. The nurse was in the room holding my hand the whole time. Anyway, next experience, when I was a little older, The last couple of years, I've had a gynecologist who was very, very sexy. In fact, he was no older than 30, maybe 31. And I made it a point to go and get waxed completely full on before I went to see him.
Really?
Yes, just because he was so cute. I knew he was married and I knew nothing could happen, but the nurse was not in the room. And when he did the breast exam, he was very detailed. Very detailed. And when he saw that, meaning, you know, he spent a good 5 minutes on each breast, and my breasts are like a B cup, so they weren't very big. And but when he saw that I was fully waxed, he just had this smile on his face, and I'm like, yeah, I'm in the entertainment field, you know. And he was like, oh, really? So have I seen you? And it was pretty exciting.
You like that?
Yeah, I mean, he was really cute.
Mm-hmm.
If he wasn't, then forget it.
If he wasn't, you'd have turned him in.
Yeah, but I mean,
But because he was really cute, you let him take as long as he needed.
I was flirting with him. He was flirting back, and that's pretty much how it went. So
now think about that. Here's a man who's supposed to be your doctor. He's flirting with you while he's got his fingers inside you.
Yeah, like asking me if you've seen me on any shows, whatnot, and I got a little embarrassed, of course, but I was having fun with it.
Really? And were you aroused by all this?
I think a little bit, yeah, of course. And I've thought about it since, you know, during my personal moments at night.
Oh, is that so?
Yeah, a little bit.
So you got a power tool or two?
No, just something small like my finger.
Oh. Listen to you. You're getting all excited thinking about it. Look at you.
Hey, you got to remember the good times.
Oh, look at you.
So anyway, do you think you can take me out, I would say, Columbine style?
Columbine style, of course I can, dear. 1-800-5800-TOM is our telephone number. It's Jesse on the Tom Leykis Show. Hello.
Hi, Tom.
Hi, Jesse.
Tom, I just love you. I listen to you all the time. I've been listening to you for a couple of years, and a lot of the guys that I work with that are whining about their wives and stuff, I always tell them, you guys need to listen to Leykis 101. I give them your number and, you know, the radio station that I listen to you on. And so you have all these deep conversations, and I try to call you, and then you come up with this. And I thought about it, and I just started laughing because I have never told a single person this.
I'm the first one who's going to hear about it.
Yeah, well, the guy that was screening your calls, too, I told him.
Oh, he already knows, so I'm the second one who's going to hear about it.
Pretty good. So I'm going to my chiropractor, and I've had, you know, back problems for years, and he's just kind of like a, I don't know, probably about 38, short, little, dumpy, geeky guy, but he's a pretty good chiropractor. And I straightened the inside muscle hiking on my right leg, and he's like rubbing my groin area. And I never wear panties, so usually it's just, you know, like with a robe over me, and he would just like reach under the robe. And he said, you know, I really think I need to do a deeper massage from the inside.
Oh, really?
Yeah. I'm like, huh. And I said, well, what do you mean? He goes, well, inside the vaginal muscle, of course.
Of course.
And I said, no way. I think you've got to be kidding me.
Close your eyes. I'm going to take out this tool here.
You know, I'm like, yeah, right, pal. Oh, no, it's not happening, you know.
Let me go into my bag over here.
Right, this little, like, dark room, right? And I just told him, no, it's not happening. I said, it doesn't hurt that bad. And I thought, like, you little geek, you know. And I have this big husband. I thought, God, if I told him, he would probably come over and clean your cloth. So I just blew it off, and I just thought, what a weird thing, you know. And I never told anybody about it. But then you're talking about this. I'm just laughing on the way home, and, you know, some of the things that happen. I've actually had to go to the gynecologist and the dentist in the same day.
Oh.
And I don't know what is worse.
I don't know. It depends on how far they stick their finger. Hang on a second, Jesse. Sarah, what did you want to say to Jesse here?
You know, I think a lot of these women have really overactive imaginations. I mean, when I go in for my pap, my doctor starts talking to me about my personal issues, too. But, you know, how's your job? How's your boyfriend? Blah, blah. Just to make me feel less uncomfortable about being their spread eagle. You know, scoot your bum down. You have to scoot your bum down.
Do you know who you're talking to?
I'm sorry?
Oh, I thought you had something to say to me.
Well, you know, I'm just calling about the topic in general. I think that, you know, if someone's attractive, then you feel like oh, well, he's hitting on me or something, or he really wants me. I really don't think that's the issue for most of the callers here.
Well, my chiropractor wanted to massage my thigh from the inside. What do you think of that?
I don't know.
Inside of my vagina.
I don't know. It sounds like...
Yes, there's some very important pressure points in there.
Yeah, right, pal.
Yeah, well, it sounds like you need a new doctor, someone a little more credible, perhaps. Maybe you should choose your doctors based not on what they look like, but based on what they can do for you.
Oh, no, I quit going to him years ago, and I have an excellent doctor now who's very good looking, and he's very professional. But I go to the gynecologist like all of them on a regular basis, and I don't have a problem with it. It's always professional. That's the only experience I've had that Tom's talking about that I wanted to share with him.
Oh, okay. All right.
All right, Jesse and Sarah, thank you. What inappropriate things has your doctor done to you?
1-800-5800-TOM. 1-800-5800-866.
Dave, you're on the Tom Leykis Show. Hello.
Hello. Is this Tom?
No, I'm the Philip. Can I help you?
No, I was just on hold.
All right, hang on.
The Tom Leykis Show.
On 100.7.
Tom Leykis Show at 1-800-5800-TOM. Monica, hello.
Hey, Tom.
Monica.
How you doing?
Okay.
Good. Well, I had an experience with a chiropractor that I actually worked for, and that was even most uncomfortable because, I saw him on a regular basis after the incident. And he agreed to do an exam for me because I asked him to. I had some back pain right after delivering my first son. And so I went back to the exam room. He told me to disrobe, except to my underwear, down to my underwear, and put the robe on and wait for him to come back in. And so I did. And at that time, I didn't know that he was not really allowed to go back in the room without the two girls that worked up in the front office with me. One of them at least should have been back there with us. But there was no one except for me and him. So I came back in, and he said, why don't you go ahead and stand up for me? So I got off the table and stood up, and he was kind of behind me, and he put one of his hands on my low back and another hand on my abdomen and told me to bend over, forward. And so I bent over. And he kind of just, said, okay. And he goes, well, why don't you step out here a little ways? Kind of made me go into the center of the room. And then he goes, okay, why don't you go ahead and stand up straight and just let your robe drop to the ground. And for like the first 5 seconds of that statement, I was pretty frozen. So I was like, what? This doesn't seem right. This doesn't feel right inside. But I was too embarrassed. Being very young at the time, I thought, who am I to say? I mean, I'm not dare going to say this is a doctor after all. So I dropped my robe, and I'm standing there in my underwear, exposed to him, and he's looking at me straight on, and he walked up to me, and he held his hands out flat and his palms up, picked up a breast in each hand, and kind of lifted them, together, kind of lifted them up and lifted them down, and then he stood back and looked at me again. He goes, okay, you can put your robe back on. So I put my robe on, and I just was devastated, mortified, and I thought, what the hell did that have to do with my back pain?
And that'll be $120.
Yeah, exactly. And I came out and told the girls, I said, you know what just happened back there? I said, I'm not trying to make any claims or anything. I said, but I'm really uncomfortable. And I told them what happened. And they said, you're kidding. He should have never been back there without one of us. And so that made me even more suspicious, and it really confirmed my feelings that was totally, inappropriate.
Wow.
And I really pretty much quit soon after that. Not just because of that, but he was a breast man anyway. He talked to your breast, never to your face. And he was a real pervert. Really was.
Wow.
Oh, yeah.
So that's kind of creepy. So I bet the next guy had to pay for the sins of the last guy, right?
Yeah, definitely.
Monica, thank you.
All right, thanks, Tom.
Appreciate the call. This is Bart. Bart, you're on the Tom Leykis Show. Hello. Bart? All right, we'll go looking for Bart. We'll say hi to Diane on the Tom Leykis Show. Hello.
Hello, Tom.
Hello, Diane.
This is Diane. I was listening to your show on the way home. And I went to the hospital and got examined below. And I can tell that he was playing with me. Because it wasn't like the normal doctors do. Then I went to another doctor, and he brushed against my breast, so I let it go. Then when I went back the second time, it really bothered me. It affected me mentally. I was really traumatized. And I told my husband about it. My husband wanted to go back there and kill him. And then my attorney was acting like there was nothing I could do about it.
Mm-hmm.
But I was really upset about it. It was like I was molested.
Mm-hmm.
And it really bothers me.
Mm-hmm.
And I said, if he's doing that to me, he's doing it to other women.
Yeah. Wow. Did you report him?
I went to my attorney and told him about it. My attorney acted like there was nothing I could do.
Well, you know, the thing is, you may not be able to sue somebody like that,
Yeah.
but you can always call, the American Medical Association or one of these organizations that these guys belong to. And you can file complaints with them and see what happens.
You said a medical association?
American Medical Association, sure.
Because, it was awful, and I'll never forget the rest of my life. My attorney told me to go to a woman doctor, so now I have a woman gynecologist.
There we go. Sounds good to me, Diane.
Neither one of them was gynecologists, though. They was my regular doctors.
Unbelievable.
They were regular doctors, like at family health clinics and things like that.
That is scary stuff.
1-800-5800-TOM.
Really?
1-800-5800-866.
I know when my dad took the strap to me, I damn well deserved it.
Nobody deserves that.
You don't think you learned a lesson along the way? You turned out all right, didn't you?
Yeah, I'm 46, and I learned not to have kids. That's what I learned.
Yeah.
I'm serious.
The Tom Leykis Show.
This is 100.7.
Tom Leykis Show at 1-800-5800-TOM. Has your doctor ever done anything inappropriate while you were in getting examined? Virginia on the Tom Leykis Show. Hello.
Hi, Tom.
Hi, Virginia.
I think you'll like this one. Well, I had to go see a specialist, not just a regular gynecologist, because I have a problem called endometriosis. And I was 21 and I was still a virgin. And when he did the pelvic exam, the pap smear, there's one thing that's still true to this day. It happens to run in the family even after babies. I'm very, very small. You have to use a child speculum on me.
Oh, really?
And
what's your number? Oh, kidding.
What do you mean, my number?
Kidding. No, go ahead.
Oh, you mean 9 or 10?
No. I was kidding with you. Go ahead.
Okay. Anyhow, you know what? Most men enjoyed that.
That's what I was saying. I was asking for your phone number.
Mm-hmm. It's never changed, and it won't change.
Really? Well, why don't you just give that on to us after we put you on hold here?
I still am like a child.
Really?
I mean, there's nothing I can do about it.
Make sure you include your area code.
The only man I was with after 2 years, he just kept saying, I can't believe you're still not a virgin.
Ah.
But anyway, the doctor, of course, after the pap, that kind of, thrilled him a bit. And then he said, well, since that hurt...
So all guys have that reaction to you, and they attempt to enter you?
Well, you know what? I was with one person. Unfortunately, I'm paralyzed now, so I only didn't get much chance.
Oh.
But the one guy, the second guy I tried to be with, he was one who didn't do much foreplay beforehand, and he couldn't get in me. And the one that I'd been with for 2 years was much bigger than him.
Really?
And I'll tell you what, though, it feels really good.
I'll bet it does.
And he loved every second of it.
I'll bet he did.
I was with it.
Yeah.
Because he just couldn't get over it. It was like...
Yeah. Couldn't get into it.
Uh-huh. And
or over it.
Even after children, it's just a hereditary thing.
Uh-huh.
And
I think we'd like to get to know your whole family.
But the doctor, he then decided, he said, I need to check your breasts now. And I'm lucky. I think I have a decent size. It's a size C. And even when I had dropped like 45 pounds and went down to size 3, it didn't change. It stays a size C.
I see.
But anyhow, so I said, I just had my breast checked by my other doctor, and he said, I'm a specialist, and I can feel more than they can. So he did the breast check, and then he decided to do the pelvic exam, and then he had to do it, and he said, you know, you really need to lose your virginity. A man's going to really enjoy this. But, and I told him.
Really?
Yeah. And I said, well, I am afraid of the pain. And all I know is as he's doing the pelvic, all of a sudden I felt a sudden sharp pain. And he said, well, there's one pain you don't have to worry about now.
Oh, my God.
Uh-huh.
Wow.
And that's the whole thing is the first guy I was with, I mean, he believed I was a virgin because I was so small, but there was no blood.
Amazing.
But, yeah, we're talking when I was younger, and even now, well, I couldn't feel it now, but I couldn't even wear the smallest tampons.
Oh, wow. Zoe, I've got 30 seconds. Make it good.
Oh, Tom, this one's good. Love you, love your show.
Thank you.
I accidentally, well, not accidentally, I had a momentary lapse of judgment once and got a genital piercing. Well, I was kind of seeing somebody at the time that wasn't really into it, so I got this piercing, and on the way home was trying to get it out, couldn't get it out. Well, it just so happened I had to stop by my doctor's that day to pick up a prescription. So I said, well, I'll catch him in between patients. I'll explain what happened.
Real quick, what did he do?